Hey, we're back. We're back. It's the last one, guys. See, Wijnland is here. Just a quick note. So like I said, it's the last one for the evening. It's been a crazy busy day, and we've got an amazing prize at the end of the talk. So if you missed any of the talks, I will be uploading those that's been on Facebook. I'll be uploading that onto Instagram, and then you can also follow me on YouTube. You'll find all the details there, and also the prize winners. I have promoted it as well on Instagram and Facebook. So yeah, we've got a great prize at the end of this talk. But now we're going to be talking to Dr. Van Waart van Wijnland, and we're just going to send him an invitation. Let me just see, Wijnland. There we go. There we go. And it's Dr. Van Waart. Here we go. Hi, Dr. Van Waart. How are you?
Good evening, Leanne. I'm well. Thank you very much for being on your show.
It's a pleasure. It's a pleasure. I haven't spoken to you in a while, so it's nice to have you. Yeah, so tonight we're talking about fibroids and infertility amongst African women. And then we obviously gonna get you to, if you could just start off by telling us where you're from and what is it you do, to give the listeners an idea of where you're from.
Leanne, we at Wijnland Fertility in Stellenbosch, quite close to Cape Town. I'm one of the fertility specialists at our unit, and it's a clinic that we started a number of years ago. And we're fortunate that we see patients from all over the country and also all over the world. So this is what we do. This is our passion.
Awesome, thank you. And then we're going to start off with, what is uterine fibroids?
Okay, uterine fibroid is basically a benign growth. In other words, it's not cancerous and very seldom would be cancerous, that grows in the uterus. Now, there are a number of them that can, or basically two different kinds of fibroids. The ones are the single fibroids, which grow, and then once they are removed, they never return again, and that's almost a once-off. And then you get the multiple fibroids, which is a different disease, and that they are very challenging, because once you remove them, very often there are small little seedlings and smaller ones that you cannot see, and they can continue growing. So it's always something that you probably have to control. Now, they also have different ways that they are put together. So some of them are soft, and they're quite challenging because they're not clear to see an ultrasound scan. You can see them, but they're quite difficult to remove because of their soft consistency. You get the ones that are elastic, so they're almost like little rubber balls. They're probably the most frequent. And then you also can get the calcified ones, which are quite rock hard, and they're quite difficult to manage as well. But these are the three basic different kinds of fibroids that you get.
Okay, and how does uterine fibroids affect your ability to conceive?
I think there are two basic mechanisms. I think some of the mechanisms we don't fully understand yet, but the two basic mechanisms is, firstly, that they can cause obstruction. So if they really sort of bulge into the uterine cavity, it's very difficult for sperm to get past there, and also for embryos to implant. And then they also have a little bit of an inflammatory change. So once they bulge into the uterine cavity where the embryo is supposed to go and sit and grow, then they cause a little bit of what we call a strange object reaction. They almost work like an intrauterine loop that can actually be used as a contraceptive device. So I think those are the two basic mechanisms. There are some other mechanisms as well, where they actually, you find them in the muscular wall of the uterus, and when they get to a certain size, although they don't bulge into the uterine cavity, they cause some adverse reactions, which also might make it very challenging to fall pregnant. But I think that part of the science is not fully understood yet.
Yeah. Okay, so why are African women more affected by fibroids?
There was a very interesting article now that came out in one of the very big leading fertility journals now 2 weeks ago, the Fertility and Sterility Reviews, where they actually looked at that. They looked at all the studies that were done all over the world. And what is quite clear, and we know that the chance of having fibroids are 2 to 3 times more in women from African origin. And they looked for causal factors to see if there's anything that stands out. And unfortunately, at the moment, there are no clear indications of why it happens more frequently in African women. And I think it's part of research that's ongoing, because it'll make it much easier to manage if we understand that part of the science a little bit better.
Okay. And then what treatment plan is recommended for women that's suffering with fibroids?
Okay, now, if you look at fibroids, we can classify them into different, according to where the positions are that they are in the uterus. Now, the three basic ones are the ones that bulge into the uterus, partially or wholly. The ones that are in the wall of the uterus are called intramural fibroids. The one that bulges into the cavity is called submucoid fibroids. And then you get the ones that we call subserosal, which are ones that actually on the outside of the uterus. Now, the ones from the outside of the uterus that doesn't bulge into the cavity and don't affect the muscular wall significantly, mostly we can leave them. But they will grow if you fall pregnant. So sometimes if you have a really big fibroid that's on the outside, and it may be 10 centimeters in size, and once you fall pregnant, they can grow to be quite large, and you might even feel like you're expecting twins during that pregnancy because they grow, because their fuel is estrogen. And pregnancy is a big source of estrogen, and also the medication and just being a woman in general gives you estrogen that can make them grow. Now, the ones that are inside the muscular wall, those are the ones that sometimes you can also leave, but if they grow beyond 2 to 3 centimeters, then most probably, if all other fertility factors are ruled out, they should probably be removed. Now, if they are smaller and they're closer to the uterine cavity, and normally the distance that we look at is approximately 5 millimeters or closer to the uterine lining, probably also good to remove if they are 2 centimeters or bigger. And then the ones that really affect fertility significantly are the ones that bulge into the cavity. And those ones really should be removed. And that we normally would remove those ones with a hysteroscope. And that means it's a camera that goes into the uterus from the vagina through the cervix. And then with a hot wire loop, we can actually resect them or peel them off. It certainly takes some special skills to do that, and this is not something that should be done by ordinary gynecologists in general, because to remove them is not that difficult, but to know when to stop and not cause harm, I think that's the challenging thing. So treatment of fibroids, some of them you can leave. A lot of them will need surgery. If you're in your reproductive years, let somebody with fertility experience and preferably a fertility specialist remove that, because the challenge is to know when to stop.
Yeah, I've just got a question that's come in. It's quite a good question, and I'd like to ask it if you don't mind. Is there anything besides doing hysteroscopy surgeries to manage or remove fibroids?
Yes, I think it's a very good question. There are two things that one can do, and that's medically. Now, the one thing that needs a little bit of research still is people are looking at vitamin D, but that's information and science that's still ongoing, hopefully, and so it seems like there's quite a bit of promise, but it has to be given in the correct way and at the correct dose. So just taking vitamin D tablets are not going to do the job for you. The second thing, there is a drug called ulipristal that actually can make fibroids stop growing. It was available in Europe until approximately a year ago, and there was a very strong drive to get that drug here in South Africa. But just as this went to the government or to the people who must actually okay it, SAPRA, it was pulled off the market in Europe because it seems like it can cause liver damage. And although it was used for quite a while, we looked very much forward to that, because it is a great drug for people with multiple fibroids. Unfortunately, it's never going to be in this country now, and research will be ongoing, and hopefully we'll have some medical treatment in future. At the moment, unfortunately not.
Yeah. Is there another one last question? I won't do this again. Sorry, doctor, but I'm just thinking, is there a reason why it's more common in the African or more up in Africa, fibroids? Why is it more common among the
Yes, I
African
think
women?
I think I'm just going to repeat what I said earlier. I think there's a big study that was actually quoted looking at all the studies done in the world on fibroids, and the incidence is proven to be more, but there's no clear reason, and it must be
Okay.
somewhere genetic, which is difficult to pinpoint. And I think just as we see that diabetes in the Indian population is more frequent and cholesterol in the South African population is more frequent, I think in African women, fibroids are more frequent, but we don't fully understand that yet.
Okay. Okay. And then do fibroids return once they are removed?
Yes, I think if you remove a fibroid, that specific fibroid won't return. And as I said, there are two different kinds of fibroids in general. The ones that are single, so if you remove them, you're probably fibroid free for the rest of your life. If you have multiple fibroids, and I think that's also more frequent in African women, it is a challenge because if you remove them, there might be smaller ones that are a few millimeters in size, which you cannot see, that will grow again. And we see
Yeah.
that frequently. We do a good procedure. You remove all the ones that will impact fertility, and then the patients wait for 18 months before they want to fall pregnant, and then there are 3 or 4 more ones that are 3 or 4 centimeters, and very often we would get the criticism say, why didn't you remove them initially? The thing is, you couldn't see them. So they will grow, so the fibroids don't return, but depending on what kind of fibroids it is, there can be seedlings that grow. And that's the
Okay.
very challenging part.
So is there like a short time period that if you have fibroids and you have them removed, is there a time period that like try and conceive in that time frame?
Yes, I think that's a very good question. And yes, definitely. So I think once you've done the removal of the fibroids, and would very often do that laparoscopically with a camera, and then what you do is the uterus have to recover. So although the patient will recover quite soon, the uterine lining has to recover, and also the uterine wall to be strong enough to carry a pregnancy, and just for the inflammatory changes to go away. And normally that would be somewhere between 3 and 6 months. So I wouldn't wait longer than that. So it's not a great idea to have the fibroids removed to try and fall pregnant and then waiting a year or two. So I think imminent. If it does, your fertility specialist will guide you when is the optimal time to do that. And very often what we would do, depending on the patient's age, we would advise them to freeze embryos, firstly, depending on the age. Because if you lose 6 months or a year in a patient that's 38 or 39 years old, the quality of the embryos will definitely be different in a year after that. So we would sometimes discuss with the patients that they should make embryos. Then you freeze those embryos. If they're good quality, then you will carry out the surgery, wait for the recovery, and once the recovery is complete, one would transfer those embryos. But the advantage that you will have is that the day that the embryos are made, their potential stays the same in the next couple of years as long as you
Yeah.
keep them frozen.
Awesome. And then we have one last question is, do you have any words of wisdom for women currently trying to conceive?
Yes, I think what is very important is that any young woman who wants to have a family at some point in time should rather go and see a gynecologist earlier than later. I think sometimes the women think just to go for a pap smear with a GP is okay, that's looking after your health. That's a very small part of female health. Make sure that you make friends with a gynecologist. Hopefully that gynecologist will accompany you through your life, and they will pick up those fibroids early and refer you to the right person to remove them. But if you wait too long, and unfortunately we see that the patients come there and then they have these huge big fibroids and they never knew about them. So once they are smaller, they're much easier to remove and control. So I think gynae examination early in your adulthood is a very good thing. I think if you are of African origin and we know that fibroids are more frequent, rather better to plan your family a little bit earlier than later. So we very often find people actually pursuing professional careers and then come at 36, 37, 38 and they want to start a family, And that's too late sometimes. So if you have gone for your gynae checkup and you are okay, remember the quality of the eggs also diminish in time. And I think also the last point that my suggestion would be is just make sure of your fertility status. And the very easy way to do that is to have your anti-Mullerian hormone test done. That's the little hormone that gets secreted by the follicles or the eggs that you have left. But don't be fooled by a good anti-Mullerian hormone count if you are older. I'd much rather take a lower AMH with younger patients than a high AMH with older patients. So I think the balance is the perfect answer. So go to your gynecologist early, be advised about your fertility status, and it makes things just much, much easier to plan in the future.
Awesome. Thank you very much, Dr. Van Waart. It's always a pleasure having you around. And then just if you can just give your details of how they can contact Wijnland. If they Wijnland's in Stellenbosch, am I right?
Yes, that's correct. Our website is www.Wijnland Fertility, but Wijnland is spelled W-I-J-N, Wijnland, the Dutch spelling, .co.za. And we also have a Facebook page, and you can follow us there. So I think easiest is probably through the website to contact us.
Perfect. Thank you very much, and have a great evening, Doctor.
Thank you, Leanne. Keep well.
Pleasure, bye. So guys, so those of us who just that's been with us throughout the day, I told you guys about this amazing prize from Biocerta. Thank you. First of all, thank you for everybody that's joined us today, that supported us to this talk. Again, I'm going to remind you that there is if you are in the Cape Town region and you want to join part of our support group for women that's trying to conceive, it will be held at one of the fertility clinics in Cape Town. There's no charge to it. It will be held on a weeknight. It will just be an hour. Let's come out and help support one another. You can come alone, you can come with your partner, your husband, whichever way. You might, it might just be that question that you want to ask or the advice, or maybe you can give someone else advice dealing with it. So the winner of the Biocerta giveaway, let me tell you about Biocerta first. Biocerta is a DNA test where they take a swab and they can actually see exactly what it is that you are lacking. If you are trying to conceive, what vitamins your body is lacking, what it's needed. So we have one winner for this, and this person has been with us all day long. She's been on every talk, commenting and sharing and everything. And her name is Shireen Hendricks. Shireen, thank you very much for your support. Please email me. You are the winner of the Biocerta DNA kit. The DNA kit is worth 3,395 and 98 rand, sorry. So it's about 3,400 rand. Well done, Shireen. And thank you very much. And I hope this kit helps you, fulfill your journey and your dream of being a parent. Like I said, this Biocerta kit from Biocerta is amazing because it tests your DNA and it can tell you exactly what it is that's wrong with you, what your body's lacking. And check out in the coming weeks, we'll have more posts about this kit and where it's available and how you can go through it. Again, there's another competition running throughout the month, a giveaway running for the rest of the month, a Dolphin Family Starter Pack that you guys can win. So please do join us, and all the videos will be live on our YouTube channel. Please go follow us on YouTube, subscribe to us on YouTube, and thank you guys for doing a very successful World Fertility Day. The help of all of you ladies are amazing. Have a great evening.